Hi everybody, it's Dr. Newman. I want to talk a little bit about how breast lift surgery in my practice has changed. I do a lot of breast lift surgery in my practice, and the way that I do breast lift surgery today is very different than the way I did it when I first started my practice. And the biggest change really is this whole concept of what I call plus minus breast lifts. Not just in patients who are asymmetric to start with, but really any patient that has a significant amount of breast tissue. And it's interesting because if you look at breast augmentation patients, and you look at people who are starting off as A cups and look at them as they age, and then look at patients who are starting off as C cups who have breast augmentation and follow them, you'll find that the smallest amount of breast tissue that somebody has to start with ends up giving them the most longevity for their shape. And what I mean by that is that when people are starting off very small, their result lasts longer because when an implant is placed under their muscle, the implant itself isn't subjected to the forces of gravity and aging the same as the breast tissue that's sitting on top of the muscle, which is kind of acting separately, and forces act on it separately without the protection of that muscle, which adds some elastic support for the implant. So as time goes on, the breast tissue that sits on top of the muscle, which is not affected by the muscle, ages just as it would in anybody else, yet the implant that sits behind the breast tissue has some support. So what I'm finding is that I can give patients a longer lasting result by using a little bit more implant and taking away a little bit of their natural tissue. Either way, their size is the same. If a patient wants to be a certain size, if instead I use a little bit more implant but take away a little bit of natural breast tissue, the resulting size is the same. But the result that somebody gets is something that I have more control over, and the way that somebody ages as time goes on, I have more control over. So the best example I can give you is when somebody comes in with too uneven breasts. The way that we would manage this years ago would just be to use a larger implant on their smaller breast, and that way we would try to balance out the size. But what I'm doing now instead is I'm reducing the breast size on the larger breast. So now I have two breasts with the same amount of breast tissue. I'm then using the same size implant on both sides. So people end up with two breasts that have the same amount of implant, the same amount of natural tissue, and they end up aging better. This has really changed my practice and my results dramatically as time goes on. And it's something that I think should be a part of every surgeon's routine, and it should be something that patients need to learn about and ask your doctor about, because in almost every breast lift patients, I'm doing this now.